The paradox of beauty and tranquility hiding a coastal excess of disease and poverty.
I don't think any town should be suffering the way that this town does.
Hastings' picturesque seafront is a mask for stark health inequality.
Smoking, alcohol and drug abuse is very common in this area.
With lower life expectancy in one of the most deprived areas of the country.
If I do drink again, it's going to kill me. And I'm not ready.
But a town that may hold answers for wider public health.
We need to solve the public health problems of coastal towns if we're to solve the public health problems of the nation as a whole.
I just drank from a young age, so I've always been a drinker.
In Hastings, Anne-Marie's struggles with alcohol addiction are far from unique.
I've got cirrhosis on the liver now and it's not reversible. I nearly died. They said she's not going to make it. So they had to round all my family up to say goodbye to me.
There are significantly higher rates of alcohol-related hospital admissions here than the national average, but stigma seems at times to be a barrier to broader healthcare access.
They just class us as addicts. They don't see the issues behind why we start drinking. We've been branded as something different. We've not been heard.
This week I turned 4 years, 2 months clean and sober. Wow. Hardly any caffeine, no drink, no drugs, no nicotine.
Like a new person sitting over there, Darren. It's amazing.
At this workshop run by local addiction recovery charity Ezra, there are multiple health needs.
I've got lungs, heart, liver, pancreas, nervous system, all complaining.
But some describe a reluctance to be open with professionals.
I think it'd be better for everybody if everybody felt that they could tell the truth.
Yeah.
I mean, it would be easier for the doctors and easier for everybody.
And charities like Ezra are filling a gap, calling surgeries, because if they don't, no one will.
That's the greatest need, isn't it? That people need to be accessing healthcare at the appropriate time, and we all know at the moment that that is hard for everybody, but for clients that have chaotic lifestyles, it makes it even more difficult. If they don't get the right treatment, then they will die.
That's how urgent it is.
Yeah.
In Hastings, life expectancy is more than a year below the national average, but if you look closer, in some areas here, it's even worse.
Perhaps the starkest example of health inequality is this. If you're a man born here in central St Leonard's in the town, your life expectancy is more than 11 years lower than if you were born less than 30 minutes away, inland, in Crowborough North East, for example. If you're a woman, it's more than 8 years lower.
Poor housing has also been linked to poor health, particularly rentals, with Hastings' rental sector twice the average.
Up here is a leak that has now formed mushrooms. There's obviously damp you can see and all the black mould coming through, the wood's rotting away. My mattress has grown black mould. There we go, and that's all ready for you.
Rosie and her 7-year-old daughter Ella rent privately, but now have to sleep in the lounge.
Now she's got asthma. You never had that before, so I think that's to do with the damp and the mould in the property.
How does that make you feel?
Rubbish. So yeah, it's not great. And she could run down the beach and everything before without coughing. Now she struggles to run around without wanting that asthma pump.
Nice to meet you.
In an exclusive interview, the chief medical officer who's leading the way on coastal health inequality says without meaningful action, it will worsen.
There are people who move to the coast with health problems from elsewhere. So in a sense, they are taking the health problems of the nation and concentrating them in particular areas. And we should therefore try and concentrate some of our efforts in those places.
What didn't work in the past? Because obviously money has been put into these places, but to no tangible effect.
Generally, what's happened is each individual coastal town has been seen as an individual problem, and of course in one sense they are. Hastings is different to Blackpool, is different to Skegness, for example, but all of them are probably more similar to one another than they are to their nearest significant inland town. And what I think we need to now do is see them as a group and create a solution for them at a national level.
A lot of what's happening here in Hastings is happening in part across the rest of the country. But the difference here is that some aspects are much worse. Self-harm, addiction, smoking, teenage pregnancy, and couple that with, in general, an older population in the town, that's a huge burden on health services here. And it appears that there are less available, with difficulties recruiting and retaining NHS and social care staff.
Good afternoon, surgery.
In fact, there are fewer nurses, consultants and medical postgraduates per patient in Hastings and other seaside towns like it, compared to the rest of the country.
Once they get the training, they try to move out. We have talked about retaining people, incentivizing them to stay in this area, but those incentives has been very, very ad hoc.
The biggest cause of the life expectancy gap here is circulatory disease.
It certainly doesn't make me feel hopeful.
Chris has heart and blood problems and hasn't seen a doctor for over 5 years.
I worry now how difficult it appears to be able to get any medical treatment. If my doctor was sitting in front of me now, I wouldn't know who he was.
Work is being carried out to help improve long-term health. Barry's targeting child food poverty.
Because it's just so deprived, the issues are everything. You know, in the schools, they're doing PE in their pyjamas because they can't afford the PE kit. You know, they're coming to school with no socks on because the parents can't afford socks.
A battle that Hastings and other coastal towns are trying to win.
This is a problem which is not going to solve itself, so it has to be tackled actively, and because of an ageing population, the expectation is that if we do nothing, it'll in fact get worse.
But it's against the tide of an NHS crisis, turbulent and surging beyond capacity. Adele Robinson, Sky News.